Hello and welcome. You found the Social Work Podcast. My name's Jonathan Singer, and I'll be your host as we explore all things social work. Today's podcast is the first in a two-part series with Mary Rauktis about measurement. In today's podcast, we talk a little bit about how Mary got interested in measurement, talk about the purposes of measurement, some of the key concepts, including reliability, validity, and error. And we also talk about what to look for in a research article with regards to measurement. In the second part of our interview, we talk about the difference between measurement in the field and measurement in research settings. We talk about some of the challenges social workers have using measurement because of training, and we talk about some ideas that might be useful for schools of social work who are interested in incorporating measurement into classes other than research. We also talked about some resources that social workers can follow up on. We ended with some ideas on how social workers can really develop their own measures and think about measurement as a tool for improving their own practice in the field. Without further ado, on to the interview with Mary and measurement. So, Mary, thanks so much for being here today and talking with us about measurement. And the first question is, why are you interested in measurement?
Well, Jonathan, I became interested in measurement, I believe, through my earlier work as a nurse. You learn very quickly in nursing that clear communication is vital. And much of the way that you communicate is through measurement. Some people think of it as objectifying patients, but in fact, I believe it's nursing language in which we talk about someone in terms of measurement, their status. And so that probably started my interest in measurement. And then I was fortunate to study here at Pitt with Gary Keski and work with him on his measure of burnout for social workers. And that continued my interest in measurement. And I, without really realizing that my career was moving in this direction, I began to work with some other people, John Lyons from Northwestern University, on measuring child and adolescent needs and strengths, and some people from Vanderbilt in measuring alliance. And somewhere along the line, I found myself knowing more about measurement than I probably ever thought that I would.
What's the purpose of measurement?
Well, the purpose of measurement is to collect information about a concept in a way that is valid and reliable. And our work in social work, again, as we communicate with each other, it is really around these concepts. Depression, self-esteem, something like the restrictiveness of a living setting for an adolescent. We use these terms with each other. We need to sometimes operationalize them in a way so that we really understand what we're talking about. And so measurement is really an entire process by which we take a concept, we begin to operationalize it, and then begin to collect information about it in a way that we can collect information about it again and find the same results. And more importantly, we know that what we're collecting is really what it's supposed to be.
And when you say operationalize, what does that mean?
Well, what it means is, and I'll actually, if you don't mind, give you an example.
Yeah, that would be great.
Operationalizing, it means several things. One is that you need to come up with a conceptual definition, which is very important. People sort of skip over the definition part and get to the number section right away. But in fact, you need to think about what is a definition, so that when I say restriction, you say, oh, you mean the way that adults in a child's life structure the settings for their safety and for their developmental needs. So first you have to come up with the first piece of operationalizing is coming up with a definition.
And I could see why that would be important, because you get two people in the room and they see restriction as very different things. And what you're doing is you're saying, this is what we mean when we say restriction, and so this is then how we're going to measure it.
Exactly. We think of restriction as a way in which, again, someone in the child's life is limiting in who they see, what they do, where they go, for either treatment reasons, but also for developmental reasons. For example, Jonathan, you have, a 6-month-old daughter, an 8-month-old daughter?
Yep.
Okay. Well, she doesn't have run of the house.
No.
No, of course not. She's crawling. You have to restrict her environment in some way so that for her developmental needs, so that for her safety. I have to restrict my daughter's environment, who was 12, in a different way for her developmental needs. So we needed to come up with an operational definition so that we understood as clinicians, when we talk about one environment, a residential treatment program being more restrictive than living at home, that we understood what that meant. There was a definition. And then from the definition, we needed to think about, okay, what are the ways that adults restrict the environment for either developmental reasons, for safety, and treatment reasons? And that led to, they restrict the environment in terms of where the child can go, what they can do, who they can be with. Okay, so then that narrows it down a little bit more. That gives you you go from this rather broad definition to something, all right, restriction around these domains. Did we come up with this out of nowhere? No, we went to the literature to look to see what research has told us about restriction for adults and for children. All right, so we had these broad areas. Okay, how do we take this down even more? Do I ask you as a clinician, well, give it a number, 1 to 10, how restrictive it is? Or do I come up with discrete items that people begin to then assign a number to? And that was a big decision, because originally the rules was an ordered list of settings from least restrictive to most based on expert opinion. And we were taking a rather radically different approach to it in terms of our reconceptualization of it. We felt that, in fact, it should be empirically based. Again, depending on work, you're looking to the people who do the work to provide you with the information, but you're not asking them to rank settings, but in fact describe the settings in numeric ways. For example, where you can go in the community is anchored between a 1 and a 5, with a 1 being there are no restrictions about where you can go in the community, to 5 that you are not allowed to go anywhere in the community. And then we had 2, 3, and 4 were numbers that represented something else. I have to tell you, this was very difficult to do and required a lot of work, a lot of going to experts. It was a 3-year process, actually, to do this. So my advice to anyone out there is, if you're thinking about creating a new measure or new tool, you want to devote several years of your life to it. And so that is a rather long answer to your question, operationalizing a conceptual definition, coming up with general content areas, and then even taking it down further into, in this case, we used numbers to be able to define various aspects.
Okay, so operationalizing is having this concept and then narrowing it down and then assigning some numbers, but it's not just randomly assigning numbers. It's based on, you said, empirical, not just expert. And so, and by that you mean that you actually collected data and you compared this to that, not just relying on the folks out in the field.
Exactly. Early on in the process, we went to experts, people who knew about this work, and asked them some questions about a general approach, gave them our definition, and got their idea if we were in the right direction. Then what we did was we drafted this early draft, and sent it back to them again for their comment. And then what we did was, so we sort of had this basis to go on. And then we went to people in the field and asked them to react to this. Is this what you think of? This is our general definition, ways in which the environment is restricted. Do you think that we're tapping into the right areas? And then we got some additional comments. Then what we did was something that I'm going to talk a little bit now about, cognitive testing. Cognitive testing is a process, and it's great when you're creating a new measure. Because what we did was we drafted it. At this time, we were about round 4. And then we asked people, I'd ask you, Jonathan, okay, you completed this for a typical child in your care. And you wrote number 2 for television. Could you tell me what you were thinking when you selected that answer? How did you choose a 2 rather than a 1 or a 3? How well does this answer fit what is true for this child in terms of their television viewing? And so we were trying to tap into what people were thinking when they were filling this out, which is very important because it's sort of the black box, if you will, when people look at a question and they're trying to select the answer. Again, they're operationalizing this concept as well. It's very helpful to know what they're thinking as they're filling that out. And we actually found the cognitive testing to be it was an excellent use of time. It helped us to improve not only the items and the responses, it also helped us to improve the instructions. For example, the community-based people were really confused about the purpose because they would say, well, I don't control his television watching, that's his parent. Well, it's not about who controls, it's about what is. So we had to make sure that we were very clear in our instructions. We also found that sometimes people, the salience factor, they were thinking about the worst kid when they were filling it out, or the kid they had just seen, as opposed to the typical child. So it wasn't perfect, but it really gave us a window into people's thinking as they were taking this construct themselves and thinking it through. It was time very well spent that led to more refining. When social workers are reading articles about any study, just not a measurement study, it's wonderful if people talk about, but they don't always talk about the process of operationalizing. In a measurement article, they will. If you're reading a study about perhaps using cognitive behavior therapy in a certain setting, they may mention the measure that they used or the tool or whatever. There's several words that are often used, but they won't always tell you how they operationalized it. So that's one of the things you want to look for, particularly in a measurement article. What I think is sort of the gold standard, and some people this is my opinion, I think you need a conceptual definition from the very beginning. There should be some expert review. There should be review by certain groups. We, for example, asked that we had youth who had transitioned out of foster care alumni basically look at this, as well as experts in race, culture, and gender.
If you're reading a journal article, it's one thing to know, they used the roles. It's another thing to understand exactly what the roles is measuring. And it could be that the way I define restriction would be different than the way that the roles defines restriction, but unless I know that, then I won't know how to interpret what they find in their research. And that's one of the important things to know about that.
Yes. Now, I'm not suggesting that every time you read a research article that you go back 3 citations to try to find out about this. But if you're interested, or if you have some concerns or questions about what they found, I would suggest that you do that, to look at go back to see how the instrument that they used to measure whatever concept, whatever they were looking at, whatever the dependent or independent variables is or are. If you have some questions or interest, that you go back and you go back to the source articles to see. Sort of a bit of a detective trail, but I think it can tell you a lot. Sometimes people think, remember, these are human beings. This was a group of 4 or 5 of us who came together to work on this. We aren't the experts necessarily. So it was influenced also by our backgrounds and our thinking. So there's certainly that aspect. I think the other question you asked me, was about what is it important for social workers to know. And oftentimes people throw out the terms liability and validity a lot.
Yeah, those are biggies.
Yes, they are. And I've often had people say to me, well, particularly if they didn't like a measure, well, that's not reliable, or how valid is that? When I've worked in practice settings, and clinicians would question me about that. And those are important concepts to understand, and I'll do my best in a short time to explain them quickly. But there's some excellent texts. I know that there was an earlier podcast by Dr. Rubin, correct? And
yes, that's correct. Alan Rubin, the author of the Rubin and Babby research text, yes.
Which is a classic text I use in my foundations class, and they do an excellent job, I believe, in the measurement area with plenty of examples. So I highly recommend those chapters on measurement, but there's also some other great books about measurement, too, that I can talk about a little bit more in terms of if you're looking for particular measures. But reliability is about, there are the two concepts, reliability and validity. Validity, let me start with validity, because I think in some ways it's probably the most critical, is are you really measuring this concept of whatever it is? Depression, self-esteem, once again, restriction, child strengths, therapeutic alliance. Are you really measuring it? Or are you measuring something like it, but not quite it? And so I like to think of validity and basically, because I'm a lumper. There are lumpers and splitters, and I tend to be a little bit of a lumper. So I think of it in sort of three large lumps. One is the whole area of face validity, which sometimes people downplay, but it is critical for clinicians because it is very difficult to ask clinicians to do a measure that does not have face validity for them. They will not do it, or they'll lose it, or they'll find ways of not finding the time to do it. And so it's very important. Face validity. How does it look to people? Does it look like it's tapping into restriction of environment or therapeutic alliance with the client? And that can be done by people looking at it, or you can ask a group of experts to give you their opinion. That's sort of the lowest level of validity. It's important, though. It's very important. And then you have the idea of criterion validity, in which it's sort of the next level. How well does this compare to some sort of external criterion? Does it predict something, or is it close to something that's current? So if you're looking at criterion validity for a test, for example, how well does it predict that student's first-year grade point average in college? The SAT is a typical example. That's important. Again, it's taking a little bit closer. Or how well does it distinguish something from an external criterion?
Well, since we were talking about restriction before, what would be an example of criterion validity for the restriction measure that you were talking about?
Normalization.
Normalization. Okay, talk to me about that. Yeah.
And this came up, again, in the process, in this marathon process of working on this measure, we found that, restriction is similar to normalization, but not the same. Normalization, again, I'm trying to think of a good conceptual definition. Normalization is the ways in which an environment is typical of a home environment. How normal is your environment or your school environment to what is typical? But it's not, I believe it's different than restriction, which is normalization is an element perhaps of restriction, but restriction is bigger. So I think of restriction of environment as being the larger construct, with normalization being an aspect of it. So, for example, in testing this new measure of restriction, which, by the way, we call the REM-Y, which we need to come up with a new name probably at some point.
The REMI?
The REMI. Yes. I didn't say we were too good at names. Restriction environmental measure for youth. What we would do is find another, for example, I would perhaps go to a group home that you are part of, or you're working at a group home, and I would ask you to fill out the REMY, and another measure perhaps that taps into just normalization. And I would look to see how they correlate. They probably will correlate. They'll probably, as you see increase in restriction, you may see decrease in the normalization score. We've not done that, to be honest. What we have done is, because it's still such a new measure, we've looked at it in terms of, we have the face and the content validity, but we haven't started to do the criterion validity. But that would be, I believe, the first place we would start. So we want to see if it's like normalization, if it correlates, and how well it correlates. Or if there's no correlation at all, then I would be a little concerned, because I believe that normalization is a piece of restriction, but not the whole thing.
So the criterion validity requires you to have an idea of what it's related to.
Mm-hmm. Exactly.
And if it's not, then you have to find out why.
Exactly. And is it because of some sort of error? Is it an error? And again, once again, I refer you to Rubin and Babby's excellent book. But error can be systematic error or it can be random error. And usually when you have a problem, my experience has been when you have a problem with criterion validity, it may be because of systematic error, that there's something about the question that people are systematically, as opposed to sort of random goofiness, in a systematic way, people are answering it differently because perhaps they don't want to admit that their environment is that restrictive, and so there's a social desirability bias happening. And so they're making their environment look really normal, perhaps when it really isn't. So is there some sort of bias happening here because of, or is it being answered in a different way because of cultural reasons? So oftentimes, if your validity is not looking the way you might like it to be, you might want to go back and look at sources of systematic error. And I typically look for social desirability, and I look for some sort of cultural bias that might be happening.
So you mentioned 3 types of validity: face,
criterion, and the last is construct.
Construct validity, okay.
Right, which is sort of the highest level. It's what you aspire to. And oftentimes it's what takes measures perhaps many years of being used in order to to achieve this. And this is the sense that what you're doing is you really are measuring whatever this concept is. And
so for example, I'll just throw something out. So you would have depression, right? Which is it's a construct, right? You can't point to something and say, "Oh, look, there's depression sitting over there at the curb," right? So this construct validity is to say that really is depression, and it's not.
It's not anxiety. It's not anxiety. It's not fear.
Right. It is actually depression.
Right. And it takes. It often takes time for people to use. Say you have this new measure of depression. So it has some face validity. Clinicians like it. They use it. It seems to be able to predict when people are depressed. It seems to discriminate when people are depressed versus anxious. And then you start to use it. It gets used by a lot of people. And then you begin to build this sort of body of research around using this measure, and that you find that it really begins to discriminate between people who are very depressed or mildly depressed, and if you use certain treatments, it's very sensitive to change. And basically, construct validity is building this whole sort of conceptual universe. Boy, that sounds sort of vague.
But it sounds like you're saying it builds up enough evidence to say, in this situation and in this and in this, we're able to say that the way we've defined depression, it fits.
Exactly.
Okay.
And so, as you can see, that takes time. It's not something that, that the first year something is out there being used. It can take several years, sometimes a decade or more. But there are several, when I think of tools or measures or instruments that people think of having reached this level. And again, in the children's field, I think of the CAFAS, the Child and Adolescent Functioning Assessment Scale, Kay Hodges' work, certainly the Beck Depression Scale for adults. So they've been out there, the SCL 90, the Symptom Checklist 90. They've been out a long time. They've been used in many, many studies, and they're reported in the literature. So it takes time to be able to do that. But it's what you aspire to in any measurement, and what you should look for when you're reading an article about how in the past it's been used in these studies, how it's discriminated, how it's not, how predictive it is, has it shown change, if it's been used in terms of evaluating outcomes. So That's why when people say to you, don't create a new tool or a new measure, it's because of these reasons. It's very creative and a lot of fun to come up with something new. It's great. It's a lot. It actually is a lot of fun. But what you have is something that is brand new. You really don't know for sure what it is you're measuring, because you need more evidence, and one study isn't enough. And so that's why we always suggest that you look for what's out there first before you go and create something new.
There are a couple things that you've brought up that I want to touch on. One of them is what you just said, which is you go out and look for existing measures, and I want to ask you about where you would look for existing measures. You also used a couple of words, measurement, measure, instrument, survey, and and I don't know if there's a difference between those or if they're used interchangeably. And also I want to give you the opportunity to talk about reliability, which is something we haven't talked about yet.
Well, let me address reliability because it's sort of part of this whole. Reliability is really about if you did it again, would it be consistent? It's really around consistency. And so if I give you this measure of depression and we do it again, is it reliably, is it similar? We wouldn't expect that in a day that you would change that drastically. So are you scoring roughly in the same area? How reliable is it? Now, sometimes reliability, it can be inter-rater reliability, and that's consistency. So if I'm observing you in a setting, perhaps, and I'm scoring you on your ability to follow directions, it would be good to know if someone else is seeing the same thing. And so oftentimes you'll have what we call inter-rater reliability. There's agreement that what we're seeing is actually happening, that we are seeing Jonathan following directions in the group home. Reliability also can be about consistency within a set of questions. So oftentimes multi-item scales, scales about self-esteem, depression, again, many concepts, will have several items that are basically asking the same thing. And you want them to be similar. So, in other words, if I'm asking you if you have energy and you say, no, I don't, then another question about when I wake up in the morning, I feel like I can go out and conquer the world, I wouldn't want you to, if you said yes, absolutely, then I would say there might be some reliability problems within that scale because you're responding one way to one item and then on a similar item in a very different way. So you can measure reliability, and that's done through statistically looking at how well items intercorrelate with each other. And so if I have a multi-item scale on depression, self-esteem, alliance, for example, I want to make sure that the questions about mutual goal setting on alliance, if I have 4 questions that are asking in similar ways, trying to tap into that people are answering very similarly on those 4 questions. So reliability is very important to look at, and oftentimes in journal articles it'll be mentioned as an alpha coefficient of point, it's usually less than 1, and you look for something in an article, that's somewhere in the 90s, 80s range is generally speaking a good range. If it's less than that, then it may be the result of some items that need to leave, or perhaps there are too few items and you need to add more. So that's an important thing to look at as you read a journal article. Now you ask me the other question. So reliability is very important, and reliability and validity are really important, and you always want to look for those as you're reading an article. I'll give you a very short example, though, about, as I mentioned, face validity and why it's so important. I was once working with a group of both parents and professionals about measuring child strengths and needs. And I found something called the Child and Adolescent Needs and Strengths, which I thought was great and would really work. And the parents looked at it and they said, this isn't it. We don't like how this is set up. It's one more thing that's done to us. We need to change this. And so we did. We worked with John Lyons, who was the creator of it, and we came up with a parent-friendly version that became a conversation as well as as something that's measurement-related. And then the professionals looked at it and said, this doesn't look valid or reliable to us. And so we had to, this doesn't look like anything that we've ever used before. And so that's a perfect example of how you really need to pay attention to that. If you were introducing something into the workplace, clinicians, family members, youth, it should be something they can, if they look at it and they say, this doesn't look right, this just doesn't look right to me, then you have a problem. And so it's an important thing very much in the practice area to keep in mind. So validity, reliability.
Okay, that's great. And so this question about our instruments, our measures, questionnaires, like, are they the same thing? Are they different?
Yeah, the language gets really confusing. And I don't know if I can shed a great deal of clarity on it, but I think the way this is my view of it. You have something that's called a survey. And when I think of a survey, I think that it's several measures. I believe measures are discrete tools that are systematically operationalizing some sort of concept. But on a survey, you could have several of those, as well as demographic information. So a survey is a
collection.
It's a collection. That's a really good term. It's a collection of measures, as well as perhaps other things. And so that's a survey. I often think of measures and tools interchangeably. And so I don't try to get too caught up in that. Instrument, I suppose I think of that more, again, being a lumper, in the measurement tools instrument lump.
Okay. Well, and I think that it's likely that there's some people out there who could say they're different, but
right.
But for social workers who are in the field, or even researchers who are looking for something, it sounds like there's not a generally agreed upon distinction that people need to know about.
No.
Okay. Were there other key concepts that folks need to know about to understand what measurement is?
Well, I did mention error, and I mentioned systematic error. I'd also like to talk about random error.
Okay.
Random error, I sometimes call it goofiness, but random error is error that isn't, people aren't systematically answering a question wrong or incorrectly because of bias or social desirability or cultural misunderstanding, but they're just, you can't predict it. Error is happening. It's the unpredictable. And that's what really can interfere with the reliability, the consistency. And so there are ways to statistically measure error, and that does happen. But I feel that it's really, the onus is on the person creating the measure tool instrument to try to reduce this random error. And you do that by what I described earlier, the cognitive interviewing, trying to find out if people are answering questions differently, inconsistently, because they're responding to something, so you're responding to something differently than me, and so you answer that question differently because there's something in the question that's triggering that, you're responding to it. So I think error is very important. It's important that people know that there's error, but that you can control for it in a statistical manner, but also you can control for it in the measurement piece by careful testing ahead of time to see where error might be introduced systematically or randomly. There's always going to be someone who has a bad day and picks up your survey and does the scales, and the next day perhaps they get a better night's sleep and they do it differently. You can't control for that, but you can do your best. Developers should do their best to try to test for it, to see at least if there's an instruction or an item that people are responding to differentially, what they can do to change that. So I think those are the important concepts, the reliability, the validity, and error.
I'm Jonathan Singer, and thanks for being with me today for another episode of the Social Work Podcast. If you missed an episode or have suggestions for future episodes, please visit socialworkpodcast.com. If you'd like to support the podcast, please visit our online store at cafepress.com/swpodcast. To all the social workers out there, keep up the good work. We'll see you next time at the Social Work Podcast.